From Vermont Public, this is The Frequency. I'm Mary Engish, sitting in for Mitch Wortley. It's Wednesday, July 16th, and here are today's headlines. The state is offering to help residents pay to fix failing septic systems and wells. Vermont Public's Abigail Giles reports.
Homeowners who make less than about $81,000 a year can apply for the money. Vermont first funded this work with federal dollars during the coronavirus pandemic. This is part of a one-time $3.5 million extension by the legislature. Examples of failures include wells that run dry or are contaminated and septic systems that spill sewage. Margie Clark is with Vermont's Department of Environmental Conservation.
I've read applications from elderly folks who actually have to go to a spring and haul water up into their homes. You'd kind of be surprised at the amount of Vermonters that are experiencing lack of access to water in their homes.
It can cost between $20,000 and $50,000 to replace a well or septic system. The deadline to apply is September 3rd. For Vermont Public, I'm Abigail Giles.
The head of the UVM Health Network says he's working to reduce spending in areas like administration and management. Sonny Eapen is the president and CEO of the network. It includes hospitals like UVM Medical Center in Burlington and Porter Hospital in Middlebury. Eapen spoke on Vermont Edition yesterday and described their efforts to streamline non-clinical operations.
These are things like HR, IT. Those came together piecemeal, and they were kind of, bucketed on. And we challenged our leaders in those spaces to say, can you reimagine how we would deliver those services to our providers?
As another cost-cutting measure, UVM Health Network executives will not receive bonuses next year. Last year, Eapen received a $600,000 bonus on top of his $1.3 million salary. Parents and caregivers of LGBTQ+ youth in Vermont now have a new resource. It's called Know Your Rights. It lists key protections LGBTQ+ kids and teens have under Vermont law. Outright Vermont created the document along with the Vermont Human Rights Commission. It's designed to help families and youth understand their rights. That way, they can take action if they experience discrimination or harassment in public spaces like schools or medical offices. The resource also shares how to document incidents, file complaints, or access legal support. Coming up, how federal cuts to food benefits could affect Vermonters. Vermont Public's Peter Hirschfeld shares what he's learned from food security experts about who will be hit hardest by the change. That's after this.
Thanks for listening to The Frequency, where support comes from Alpine Telehealth, offering telepsychiatry solutions for Vermont hospital, community mental health, and primary care. Physician-owned and operated since 2018. Learn more at alpinetelehealth.com.
1 in 10 Vermonters are getting federal food benefits from the Supplemental Nutrition Assistance Program. And many of them will see those benefits reduced or even eliminated as a result of the budget package passed by Congress earlier this month. Vermont Public's Peter Hirschfeld has been talking with food security experts about the changes coming to SNAP. That's how the program is sometimes referred. I recently spoke to him about what it all means for low-income Vermonters. Can you walk us through what some of these changes to SNAP are? Like, how will this new federal law affect the 65,000 Vermonters who enjoy that benefit right now?
It's going to affect them in a lot of ways. I'll hit on a couple of the big ones. This new law expands work requirements for SNAP. There's always been work requirements for this program, but there have also been exemptions for certain populations. Veterans, for instance, people who are homeless, low-income parents with children of a certain age. This budget package eliminates many of those exemptions, and advocates I've spoken to say this is A, going to affect vulnerable populations who can't work, or B, that it creates new administrative requirements that are going to make it difficult for people to prove that they're in compliance even when they are satisfying these new requirements. There's also a provision, Mary, that eliminates an annual inflation index built into SNAP. That mechanism was intended to maintain the buying power of benefits as the price of food goes up. That indexing mechanism is no more, and advocates say this is going to function as a cut to benefits that will deepen over time.
Wow. How many Vermonters are losing access to benefits as a result of these changes?
That's a moving target right now. The Department for Children and Families did an analysis, and they say the expanded work requirements alone will result in about 2,000 individuals falling off the rolls. Changes to the Inflation Adjustment Index that I mentioned will reduce SNAP funding nationally by about $37 billion over the next 10 years. The Congressional Budget Office says this new law will reduce overall funding for SNAP by about 20% between now and 2034. Vermonters got about $155 million in benefits last year, so potentially a significant loss in funding at a time when advocates say food security is on the rise.
And obviously, these food benefits, these are essential parts of the social safety net here in Vermont. Well, what are you hearing from state officials? How are they responding?
Also an open question. I've spoken with advocates at Hunger Free Vermont and the Vermont Food Bank who say this is a moment where state government needs to step into the breach and use tax dollars collected in Vermont to offset the impacts of these changes at the federal level. But there are lots of things in this new congressionally approved budget package that are going to affect the social safety net here. Medicaid obviously is the big one. And there are lots of state and nonprofit institutions that are going to see a steep decline in some instances in federal revenues. Vermont lawmakers and Governor Phil Scott say this is going to be a triage process where they're going to have to strategically deploy the limited state funding they have to offset some of these cuts. Later this month, the panel of lawmakers and the governor will meet formally for the first time since this federal budget package was approved. And the question of whether and how state government intervenes will be at the top of the agenda.
Thanks for listening to The Frequency today. We had additional reporting from Abigail Giles, Michaela Lefrak, and Peter Hirschfeld. Today's episode was edited by Stephanie Colombini, and our music is by Blue Dot Sessions. I'm Mary Angish. I'll talk to you again tomorrow.
These days, there's so much news, it can be hard to keep up with what it all means for you, your family, and your community. The Consider This podcast from NPR features our award-winning journalism. 6 days a week, we bring you a deep dive on a news story and provide the context and analysis that helps you make sense of the news. We get behind the headlines. We get to the truth. Listen to the Consider This podcast from NPR.